Greetings. I'm Michael Quinn Patton, author of Blue Marble Evaluation and co-author of Getting to Maybe: How the World Has Changed. I've been doing program evaluation for over 50 years, trained as a sociologist. And I'm here to discuss how society can be saved according to a new book. The answer, we have to enter the corridor of history through the lens of social science research, leading to a way forward. The book is Saving Societies from Within, subtitled Innovation and Equity Through Interorganizational Networks by Jerald Hage, Joseph Valadez, and Wilbur Hadden. The book takes us through historical analysis, social science theory, evaluation evidence, case studies, social science research, and value premises about what a quality society is like. Is in two parts. Part one covers the theory of how societies can be saved, and part two examines an actual case application of the theory that was evaluated and examines both the evaluation, design, and the result. The theory is a systems transformation theory that hypothesizes systemic, coordinated, interorganizational networks can achieve greater social equality. Part two, evaluating the theory of transformation, makes it a theory-driven evaluation. Test of the theory took place in Nicaragua using the NicaSalud Model, which was aimed at rebuilding and strengthening the public health system after Hurricane Mitch in 1998 destroyed what little health system existed at the time. Goals of the NicaSalud model were to rebuild the public health system after Hurricane Mitch, create positive health outcomes for mothers and children, reduce social inequality, and test the model of systemic, coordinated, interorganizational networks could make a difference on inequality. The book highlights the results of the implementation of the model, and the reason we're having this presentation is because the results do show important, significant impacts on social equality. And the monitoring and evaluation system that generated those rigorous results is worth looking at. And so we'll conclude the video with a set of success factors that can be extracted from the way the evaluation of the theory was conducted, analyzed, interpreted, and presented in the book. The book argues that historically there have been two dominant theories of how society is coordinated. Both of them has failed. One of them was based upon market competition, that the free market is the best way to coordinate changes in society, and the other has been government state coordination, regulation, democracy, voting as a way of managing change. And the book concludes that the market and state modes of coordination have problems because the essential actors are organizations, firms or government agencies with managers that are risk averse and or driven by self-interest. And so they call for social science needing a new vision of how society can be coordinated. The overarching premise is neither market coordination nor democracy appears to be capable of solving the complex problems that all societies confront today, whether developed or developing, and we might add to the planet. In particular, markets and democracies have not been able to generate radical innovations to ensure social equality. Integrating theory and practice, then, they state, quote, "To solve this problem, we present a theory of a new coordination mode, systemic, coordinated interorganizational networks, a mode better adapted for generating radical innovations and ensuring social equality." We're going to get deeper into this and look at an overview of how systemic, coordinated interorganizational networks work to support innovation, learning, and adaptation. So stay with me and we'll take a look at why this matters, how it occurs. Systemic component means that a diversity of organizations is involved in the decentralized decision-making, representing all parts of the specific system being coordinated. The coordinating component means an actual designated unit that has special resources for ensuring coordination is not haphazard, and that provides a platform for resolving different perspectives and building good relationships between the organizations that participate in the network. This also ensures quicker responses to new problems as they appear. This coordination mode creates radical organizational change, whether via learning, adoption, in-house innovations, or adaptiveness, as well as institutional change in the system in which it is embedded. Taken together, this is why this process is entitled Saving Societies. Elaborate it a bit more as we go forward, what it means and how to save societies from within. The innovativeness of interorganizational networks is partly premised upon a sociological law. Now, I confess I was surprised to find the book featuring a sociological law, because when I was in graduate school many, many years ago, the notion was that social sciences would not have laws of the kind that there are in natural science, because the social world is simply too variable. But this book features a sociological law that goes like this. Diversity of perspectives enhances creativity and innovativeness at individual, organizational, community, and indeed societal level. So let's explore that. How does diversity matter? What kind of diversity? Matter for what? Matter to do what? Matter in what ways? And matter how? The book explores the effects of diversity in considerable depth and why it matters. And so when we think about diversity, we often think about diversity of people, but that's not quite what is meant in this formulation. It's valuing a diverse network, not individual people, but a diverse network. What difference does coordinated network diversity make? Diverse networks increase radical organizational change through the creativity of engaging different perspectives. And that leads to greater collective effectiveness. And so cooperative behavior can build social capital at the collective level, and that collective social capital enhances effectiveness. The conceptual illumination of what constitutes a diverse, integrated, systemic network of interorganizational cooperation is a centerpiece of what the book is about. And it's not just any kind of collaboration, it's strategic collaboration that makes a difference on the major ways in which organizations function, both individually and collectively. And so systemic or coordinated interorganizational network, called SCIONs, S-C-I-O-N-S for short, are able to be effective in handling ambitious goals with uncertain technologies and fragile, complex, dynamic, turbulent environments through learning, innovation, and adaptation. So what makes this book worth paying attention to? What's the source of its credibility? There are lots and lots of books about social change, about innovation. What stands out about this book that might make it worth your while? The answer lies in the extraordinary team that have put together this book, beginning with the lead author, Professor Jerald Hage. I was his graduate student at the University of Wisconsin in the 1960s and have followed his career over many decades, devoted to issues of innovation, social change, complexity, systems understandings, and organizational sociology. Professor Hage's work on social innovation, spanning more than 6 decades, has made him a leading scholar in how societal transformation occurs. He has looked at innovation at national levels, at local levels, across sectors, the private sector, the public sector, non-governmental organizations, community-based innovation, and his cumulative scholarship has made him one of the world's leading experts on how societal transformation occurs. The team that is a part of this book includes Wilbur Hadden, who is a research scientist with him at the Center for Innovation at the University of Maryland, and Joseph Valadez, who is a professor of global health at the Liverpool School of Tropical Medicine, a community epidemiologist who has worked in more than 50 lower and middle income countries, including Kenya and Nicaragua, where the case study for this book takes place. Given the sociological principle that diversity supports creativity and innovation, I asked Professor Hage to comment upon how their team composition affected the work that they did in Nicaragua. And here's how he responded.
We come from very different backgrounds. Speaking for myself first, I'm the organizational sociologist. It's Joe Valadez that recruited me to start studying the problem of inequality of healthcare in developing countries. Joe has devoted his life to developing instruments and, most importantly, probability sampling. This allowed us in our book to have precise statistical analyses, even with a very small number of cases, in this case, 10 to 14 organizations. I might add a special program at Harvard. So he brings an enormous set of very unusual skills. He's probably done more for the development of LQAS than any other person in the world. Bill Hadden is an expert on doing data analysis and redid all the data analysis, looking for errors, and that's one of his specialties. I must say, I'm not a detail person, and Bill is very much a detail person and catches all sorts of my errors in writing and also interpreting results. I mean, sometimes I'm willing to jump off into the wild blue yonder, and perhaps the data doesn't suggest that that's necessary.
That's great.
And of course, or maybe not of course, what none of you probably know is I've spent my entire life working in diverse research teams with historians, with sociologists with very different qualifications. In other words, I practice what I preach.
Professor Hage has written a number of books about innovation, Restoring the Innovative Edge, Organizational Innovation, Innovation, Science, and Institutional Change, among others. Prior to this book, he wrote a major book on knowledge, evolution, and societal transformations, subtitled Action Theory to Solve Adaptive Problems. I wrote the foreword to that book and called it a magnum opus because it was the culmination and integration of work that he has been doing over decades about how social change occurs, and especially the role of innovation in bringing about social change. Not just any kind of social change, but transformation of major systems. We are in an era where the clarion call of our time is for systems transformation. With the climate emergency, the pandemic, increasing world hunger, violence, and economic turbulence on the rise, disinformation and misinformation throughout the world, increasing global inequities, what's come to be called the polycrisis. Polycrisis refers to multiple, interdependent, interacting, mutually reinforcing crises of a deepening nature. And it's in that context that bringing to bear the knowledge of how social innovation can occur becomes of increased importance. In his book on knowledge evolution and societal transformations, he presents a hypothesis that is confirmed and affirmed in this latest book. The Hage transformation hypothesis says that successful evolution and institutional transformation requires increased diversity in new technologies and skill sets that are integrated into systemic coordinated networks. In the evaluation webinar, while the book was being written, I had the opportunity to interview Professor Hage about the Hage transformation hypothesis. And here's what he said about the institutional transformation nature of the hypothesis.
Institutional transformation means you have to step back and look at the production system. We're back to that complex view of knowledge. And that complex view of knowledge says all the problems aren't going to come in one organization. You have to talk about how organizations are connected together. And that includes the public sector, the private sector, NGOs, and so on, and integrate them into a systemic coordinated network that's decentralized and where all these different organizations are participating in decision making and trying to develop the new technologies and skill sets and new programs to solve the problem.
He went on to say in that book that the explosion of studies about social networks has centered on Facebook, Twitter, LinkedIn, and other social networking sites, as distinct from various kinds of interorganizational linkage. Therefore, this focus has missed the most interesting transformation that has occurred as a consequence of what he calls the third wave of knowledge creation, the construction of systematically coordinated products, services, and research networks that are designed to solve complex problems by means of collaborative cohesion across diverse organizational boundaries. He went on to say further, the greater the task complexity, the more power must be shared. Since knowledge growth drives the complexity of tasks, not just in research but everywhere, even people without what he calls postmodern minds will have to learn to share power. 2 decades earlier, he did a book with Catherine Alter on how organizations can work together. In that book, they wrote that new mechanisms for coordinating and controlling different sectors of the economy are emerging, and it is the systemic network that offers the greatest competitive advantage in a global economy. Systemic networks, clusters of organizations that make decisions jointly and integrate their efforts to produce a product or a service, adjust more rapidly to changing technologies and market conditions, develop new products and services in a shorter time period, and provide more creative solutions in services. His overarching findings about generating innovation can be expressed as a narrative equation that knowledge diversity and knowledge sharing through diversity of paradigms plus cross-fertilized collective learning with innovation and new knowledge, coordinated interorganizational networks leads to social transformation. In the webinar that I did with Professor Hage in 2019, we had the opportunity to discuss this equation and to get some of the definitional qualities clarified. Here's what Dr. Hage said.
Let's start with knowledge. Unfortunately, a lot of people want to just think of knowledge as information. You know, if they know the date that the president was elected, then that somehow counts as knowledge. I see knowledge as a production process, and it's very complex because it has at least 4 components. Those components, very simplistically, are the machines, the methods, the minds, and the model, if you will, as well. And that really measure how much knowledge there is about a particular process or program that we're interested in. And we can do it across different areas. It solves the embeddedness problem. And note that if any of you are interested in the philosophy of science, it involves a materialistic and an idealistic approach to knowledge. And for the Europeans, note that combines a British and a French or continental philosophical tradition. And I think that's important. When you're developing ideas, I think you want, and complex concepts, you want to recognize that there are these different ways of thinking out there and you want to combine them. And I've tried to do that in the definition of knowledge. The same can be done with the term innovation. And in fact, the nice, interesting quality about innovation is it really is new knowledge. Whether we think about that at the individual level, a person comes up with a way to adjust their family schedule so they can spend more time with their children, Are we thinking about it more typically at the organizational level? We've got a new product that we think will do very well on the market, or a new app to build a new high-tech company. Or we think about that at the institutional level, a new way of developing a delivery system that, for example, might cut costs in the healthcare area, to speak of a current problem.
That interview excerpt was from the period when Professor Hage was writing the Knowledge, Evolution, and Societal Transformations book, which is the in-depth intellectual and scholarly foundation for the new book. And so I find that the two very much go together, that Saving Societies from Within, that updates the work and applies the in-depth scholarly analysis that's done in the earlier book on action theory to solve adaptive problems. Systems and complexity-based theory of transformation, then, is a different way of looking at the world through these interorganizational networks. As an evaluator, I've watched and been a part of the evolution from evaluation beginning looking at only goal attainment, to then doing logic models and moving to theories of change, and now needing to embrace and deal with a theory of transformation of the kind that Professor Hage offers through his in-depth, long-time research. Indeed, a cumulative body of research and knowledge points to interlocking networks as the pathway to transformation in complex dynamic systems. And this latest book provides evidence pulled together of that and a case example points. We turn now to part 2 of this videotape, the evaluation of systemic coordinated interorganizational networks, the impacts on the people in Nicaragua, on their health, and on social inequality. And they provide an in-depth case study of the NicaSalud model that was a set of organizations that came together after Hurricane Mitch in October of 1998 in the mountainous regions of Nicaragua, basically destroyed the public health system and had to be rebuilt, and was rebuilt and evaluated through interorganizational networks. Their study in this book, funded by USAID, asks, are there advantages to funding a group of organizations rather than funneling an entire grant to a single organization? In other words, it's easier, and it is the tradition, for funders to fund single organizations in a nice linear logic model. There's greater accountability there. There's more manageability there. Is that the best way to go about it? And what they demonstrated in the book is that the advantages of interorganizational network for public health programs. The interorganizational network creates a culture favorable to change and adaptiveness. Here is the big question. Can the increased learning, innovativeness, and adaptiveness of systemic coordinated interorganizational networks contribute to reductions in inequality? Taking that question seriously, the project incorporated in the evaluation major measures of reduced inequality, changes in mothers' behavior and knowledge, impacts on safe motherhood, impacts on child survival. And they set a standard that they decided with the members of the network would constitute a big enough change that would represent a reduction in health disparities. The book says, we believe in measuring whether social equality has been increased by a noticeable difference, and that 10% is such a marker. To understand the importance of this claim and its credibility, we need to look at the overall methodological approach of the project, which is based on lot quality assurance sampling. LQAS is designed to identify areas of high or low performance. With LQAS, information on a sample is collected in an area. For each indicator, the number of successes is counted, and compared with a predetermined cutoff target. If there are fewer than targeted successes, then the area is classified as low performance. If there are more successes, then the area is classified as high performance. The determination of the cutoff target is a function of the sample size, targets for program coverage, and related practical considerations. This approach has such wide applicability and is so critical to understanding the data in this project that we're going to go more deeply into it. I asked Bill Hadden, the statistical sociologist on the project, how this works in practice. Here's how he explained it.
It relies on small samples, and the data collections are the people that work. You define your sampling areas by your clinically relevant administrative areas. So the catchment area for a clinic or a public health unit of some kind is your sampling area. And the sample size, the standard sample size is 19 people. So the only thing you can say based on those 19 people is we're meeting or not meeting the target with a modest degree of probability of being right, a meaningful degree, but nowhere near certainty that we're being right. But if you take those 19 people here and 19 people there and all these places, and you combine them into one sample, it's a representative sample if it's been properly drawn. It's a representative sample of that larger unit.
Valadez is the world's expert on lot quality assurance sampling. He was a pioneer in developing this approach for public health applications and directed the fieldwork and design of this project in Nicaragua. I asked Joe to explain the value of LQAS to the local people with whom he worked and who implemented this approach. Here's what he had to say.
The demand by local managers in the field is to understand how effective they are being in reaching the population with their scarce resources and having the beneficial impact. Well into the past, large macro surveys were looked at for that purpose without really taking account that the conditions at the local level are maybe very different than the average condition that would be depicted by, let's say, a demographic and health survey, for example, which serves a very valuable role, absolutely valuable. But to extrapolate that to a local level just isn't effective. So when this problem was posed to me by the Pan American Health Organization years ago, for help, I looked at industry. It was dealing with the problem of how to manage an entire enterprise, your program, and yet have those units that comprise it, factories, have their quality controlled. And I was fascinated by that approach, but it needed much adaptation because we're not controlling light bulbs here, it's health centers. So the benefit of it is it gives the local manager insight as to the quality of the service delivery, and then allows them to make decisions about how to improve their team. Or better, it can aid the team itself to look at the information, which happens in many places, in order to understand what their own impediments are and improve upon it. So it's that local empowerment issue that's important, but also providing accurate data that has greater construct validity for the users.
So what were the results? In summary, they write, the NicaSalud intervention, not just in separate NGO interventions, but also in the totality of the SCION, created a considerable amount of behavior change in women being assisted in birth and having a postpartum visit and seeking treatment from a health unit for a child with diarrhea as well as with oral rehydration treatments. All of these can be expected to contribute to a general improvement in child and infant health and to a reduction in the health gap. Therefore, we conclude that the systemic coordinated interorganizational network did increase social equality. And we also indicated which specific interventions or investments proved most effective. The sampling approach created representative data to determine how well the standards for increase in social equality were being met. But of equal value was that the data were behavioral data, not just asking mothers to report on whether or not they were engaged in desired practices, but to actually observe them engaged in those practices. Bill Hadden explains the value of the behavioral data and its importance.
It's especially good because they realized that you couldn't just ask people, do you know how to do this, and expect to get a good answer. The data on, do you know how to prepare the ORS is, they sat down and said, here, make me some. So that's a grade on a performance exam, the treatment for diarrhea. And the components of that survey, all those questions are very standard questions that have been developed in the demographic and development community.
The behavioral data was viewed as highly valid and reliable from a social science measurement perspective. But how did local project participants react to and use the data? Joe Valadez gives an example.
In the first year, in training everyone in LQAS, there was pushback because of lack of understanding, and also they were trying to gravitate toward the mean, what they normally do. And however, with the NicaSalud team, who was doing the training with our support, which they asked for also, we've all very, very much bonded. When the results came up, the NGOs were startled to see that there was no improvement whatsoever in the preparation skills of oral rehydration therapy in their own locations as well as in the aggregate. And that mothers, however, mothers actually had low level as well. So they implemented their typical communication programs in each of their areas to improve use of ORS and knowledge about how to prepare it. At the end of the first year, each had this similar experience, which was to learn that indeed moms were beginning to use ORS much more frequently. A larger proportion of them were. However, they were preparing it incorrectly. And as a result, the life-saving benefit of ORS was not there. That it either have too much salt in it with not insufficient water, which is deleterious for the person, could aggravate the diarrhea, for example, or that it had just not enough salt and too much water, which would have just the same effect of drinking water only. So they were all extremely upset with themselves and just existentially upset that they were not doing, they could possibly be doing harm, certainly not benefit. So they collectively decided as a group, without our aid or facilitation of that discussion, that they would dispose of all their communication programs. And what they actually began doing is using the question that was in the questionnaire as their learning tool, which basically was they had the mothers. The questionnaire asked mothers, "Can you please prepare ORS? Are the ORS sachets that are available in the project. Take whatever one you want and please make it." Then each of those steps was assessed as being right or wrong. Well, at the end of 1 year, what was clear, it was incredible. It was like an improvement from something about 23% this is speaking in aggregate, 23% correct preparation to about 80% correct preparation. I had difficulty believing that. So what I did is, because I'm a skeptical sort, as I should be, and we went out into the field and visited many locations to view what the interventions that were reaching the population with essential knowledge and why the improvements took place. It was astounding. They had integrated this preparation exercise into literally everything they did when they came into community. It was to deliver ORS sachets or to do growth monitoring or to pick up some information, administrative information from the community about whatever it might be. There would be the mothers groups get together and there would be this practicing, and it would be the mothers who would spot the incorrections and they would correct the other mothers that were in the group. It was a fascinating development of social capital that was taking place in these communities. I was so impressed. I was convinced that we really had good data.
Now, I've heard from the book's authors about how they implemented evaluation of the NicaSalud model. The goals of the model were to rebuild the public health system in Nicaragua after Hurricane Mitch, create positive health outcomes for mothers and children, and the evidence in the book is that they accomplished that, to test the systemic coordinated interorganizational network approach, and we've seen evidence of that, and the book goes into that in great detail, and to reduce social inequality. How that was to occur was through the commitment within the systemic coordinated interorganizational networks to make reduction of social inequality a priority, to use the LQAS methodology and collect both knowledge and behavioral outcome data, and to use that data in a way that would change the system to reduce inequality. I asked Professor Hage, what has driven you to devote decades of research to social innovation and the role of systemic coordinated interorganizational networks in supporting greater equality? Here's what he said.
To have systemic coordinated interorganizational networks is because fixing the problem of inequality is not a one simple process. It's a continuous process that requires grappling with all sorts of obstacles, which are different in different parts of the region and for different people. And it's only with this kind of sustained effort that we can hope to make some progress. And furthermore, that progress frequently runs into opposition. And another important advantage of a systemic coordinated interorganizational network is that you have a team of organizations that can put pressure. Now, if I may speak personally, this comes from a long-term interest in inequality that I first obtained when I was 8 years old and I saw an unemployment line in 1940. And it really upset me. And after that, I started saying, I'm going to try in my life to see if I can do anything about that. The second point is I can't think of any greater sign of inequality than letting people die unnecessarily early on. Trying to give people an equal length of life within the circumstances of genetics is, to me, one of the most important battles.
So it's clear from reading the book and talking to each of these contributors that this has been a team effort built on diversity of skills and creativity and innovation in approaching the challenges they faced. And so systemic coordinated interorganizational networks are able to have an increased capacity to learn, innovate, and adapt. They also need the capacity to evaluate. And so the book offers a general theoretical framework for measuring network effectiveness that includes increasing the human capital of each member organization via training programs in both tactical and managerial areas, encouraging organizational adaptiveness as measured by their changes in strategies and tactics, expanding institutional capacity in strengthening the healthcare system via basic functional training, new skill training of all members of the network, and healthcare personnel in the Ministry of Health and its various clinics, mobilizing political advocacy and change policies and institutional roles with stakeholders to make the healthcare system more effective, and generating cooperative behavior among the member organizations as indicated by the sharing of resources, the building of political alliances, and joint planning of interventions within the same geographical areas, including encouraging the formation of subnetworks that can make a larger interorganizational network more effective. Given the extensive evaluation data reported in the book on the case study in Nicaragua, I asked Professor Hage what stood out to him about how the project unfolded and their engagement with the network in Nicaragua. Here's what he had to say.
It's testing the efficacy in a very detailed way of the SION concept. But most importantly is that it's an example of what I mean by action research. In it, we give detailed principles to managers who want to do the same thing. And that's very important. It's not only the abstract idea of a SION is better than a market or a state coordination system, but here are the concrete steps as to how do you establish one and keep it operating and why it works. And for me, coming out of my Norwegian background, that's a very important element.
Let me now take the case example in the book and that general framework and create an interorganizational network evaluation matrix that looks at evaluation in 3 levels: the impact of the network itself, impacts on network members of being part of the network, and the impact of the network on the larger society. This allows us to systematically look at the full dimensions of network results and impacts. Here you see the 3 arenas in which there is impact. In the middle is the network capacities and results to be evaluated. That focuses upon the characteristics, qualities, and products of the network itself. And then there are the impacts on network members, both the impact of the network on the members and the impact of the members on the network. So it's a 2-way flow. And then the network itself aims to have an impact on society. This creates then a 3-dimensional systematic evaluation impact matrix that allows us to track and follow how those 3 levels are in fact mutually reinforcing and interdependent. The evaluation of the network qualities in the center, the member changes before that, and the societal system impacts afterwards. And so what we get is, in the center, evaluation of network qualities includes strategic coordination, innovations that the network undertakes, adaptations, and learnings of the network. The network member changes include changes in their knowledge, behavior and relationships, attitudes and values, and strategic changes. And together, the impacts of members and the network is aimed at having societal impacts on equality, sustainability, building social capital, and transformational trajectories. An evaluation network over time then would examine and document what is maintained in the network so that things that are working well are continued, what gets pivoted in the bottom left there, those are adaptations and changes, what gets expanded, and what innovations take place. 4 of the book is reporting on the evaluation of the NicaSalud model. in Nicaragua. And because the authors believe that this evaluation and the model itself has larger implications beyond Nicaragua, they've presented the book as elucidation of a model, not only for systemic coordinated interorganizational networks, but for evaluation. And in my 50 years of doing evaluation, I believe that what they've done constitutes an exemplar. Evaluation approach is a complex, multidimensional, multi-method approach that I can't do justice to in the video. What I'm going to do is spotlight some of what I consider the highlights of the evaluation approach in the hopes that you'll take a look at it in greater depth to appreciate the dimensions and scope, comprehensiveness, and the utility of the evaluation. So I've extracted 10 dimensions that I think are particularly worth highlighting because of what they teach us about how to do credible and useful monitoring and evaluation is general, but also in support of systemic coordinated interorganizational networks. So I'm going to take you through at least my top 10 list. First factor is embedding M&E into the network from the beginning. So often, evaluation doesn't get built into an intervention until it's already been designed, is being implemented, and then M&E gets added in. But we know that to be useful, evaluation needs to be part of the initial design, needs to be engaged from the beginning. Building on the urgency to work together that came from the humanitarian disaster of Hurricane Mitch, they generated and nurtured the commitment to M&E among the network leaders from the very beginning. And that commitment at the senior leadership level makes a difference we see all the way through the intervention, the project, and the evaluation. A second important factor was evaluation capacity strengthening. They did extensive high-quality training and engagement of technical and support staff in how to implement the M&E. And the book talks about the importance of dealing with both administrative leadership around evaluation, but also the lower level technical and implementation staff. They found that, quote, it was the technical help on the M&E baseline and final evaluation that contributed largely to the considerable amount of learning, innovation, and adaptation that occurred, and thus the strengthening of the healthcare system. A third element was a clear, appropriate, and useful evaluation design that included mixed methods, both quantitative and qualitative. They incorporated the mixed methods in a way that integrated the data so that the qualitative data reveal what was actually done in the strategies, what was done in the field to help explain the quantitative indicators and results. Outcome indicators on maternal and child health, documenting organizational learning, systematic data collection, analysis, and feedback of both kinds of data throughout the evaluation clearly made a difference. Then a unique factor that you don't see in a lot of evaluations but deserves special spotlighting here is using the lot quality assurance sampling approach. Probability-based approach, LQAS is designed to identify areas of high or low performance. With LQAS, information on a sample is collected in an area. For each indicator, the number of successes is counted and compared with a predetermined cutoff target. The LQAS approach was discussed earlier in this video, and its importance to the overall success of the project is a major reason for including it on this list of M&E success factors. Fifth success factor is rigorous evaluation on key health, knowledge, and behavior indicators. They make a clear emphasis on having both knowledge indicators and behavior indicators and understanding the difference between them, and that knowledge does not automatically lead to behavior, and therefore it's important to know both what people know about health and what they do about health, and to have baselines on both knowledge and behavior. Often, baseline data refers only to the knowledge side and not the behavior side. So they were rigorous in being sure that the baseline data covered both knowledge and behavior. And the use of the results affected the intervention priorities and implementation from the beginning. So the baseline wasn't just for comparison of change at the end. The baseline revealed things about the current situation that affected the strategies and the tactics that were used in the health interventions. On the importance of the baseline, they comment, quote, both the area supervisors and the line managers were usually astonished by the low proportion of women who knew a specific piece of health knowledge, such as perinatal danger signs. The M&E evaluation method thus destroyed what might be called the pluralistic ignorance of the member organization's staff. I love that phrase, the pluralistic ignorance, so that the shared ignorance of staff about what's really going on in the field affects what they do. And when you've got good baseline data, you can destroy that pluralistic ignorance. They now have data about what's happening that can help guide the intervention. And the baseline was used in that way. Impressive. Sixth dimension of success is the participatory collaborative nature of the evaluation. The training of data collectors, who were usually area supervisors, involved teaching them how to analyze and interpret their findings. The authors say, quote, without this training in the interpretation of the findings, it is not clear that the importance of the baseline scores would have been realized. And so the working with the people collecting the data, involving them in making sense of the data, interpreting it, and communicating its implications for learning, innovation, and adaptation was a key element in having the evaluation make a difference to the project and to the work. A seventh element was systematic tracking of strategic versus tactical actions by the network members. Strategic actions are changing how they go about doing their work. Tactical actions are improving a specific kind of intervention. Both are important, but when they talk about radical innovation, they're talking about strategic changes in what is going on. And distinguishing and coding innovations from adaptations was part of testing the systemic coordinated interorganizational network model. These distinctions allowed in-depth discussion of the kinds of learning that took place and how the learning became operationalized in changed practices. Direct field observation. There's so many evaluations where the data are primarily collected from the capital, where their secondary data is only used, or where survey data are used without the evaluators, especially the senior evaluators, actually going out into the field. But I was impressed where Jerald Hage was a participant observer in Managua, the capital of Nicaragua, and the various regions where Joe Valadez showed him the locations in which the interorganizational members worked and where he had been working for several years. Quote, seeing armed guards in every hotel and international restaurant, and knowing that one is not to travel at night, and even a car gives one an idea of how important the drug traffic and street crime are, visiting poor villages over bumpy roads brings home the difficulty that pregnant women have traveling to health clinics. Indeed, the observation leads to an emotional understanding and empathy, and does one dare to say even a verstehen, deep understanding of the situation. No substitute for going directly into the field, and the book describes a number of important discoveries that came out of direct field observation, both by the evaluators and by members of the network. Ninth, I consider this to be a utilization-focused evaluation. The evidence of use runs throughout the book. A well-designed, implemented, and used M&E system, quote, is fundamental to the process of adding value by network organization. The concreteness and validity of the behavioral indicators used for measuring safe motherhood and child survival provided credible evidence to network leaders about where they were effective and where they were ineffective. So the high level of use came from having good data, baseline data, people trained in how to interpret the data, spending time with the data. It was timely to affect decision-making that was going on, and the data was of such recognizable quality that they focused on what to do with it rather than arguing about whether or not they agreed with it. The findings, in effect, were used. Which brings me to the 10th and final success factor, and that is that this was a systemic, coordinated, evidence-driven interorganizational network. Simply referring to it as a systemic, coordinated, interorganizational network doesn't do justice, from my perspective, to the role that evidence played in the success of this project and in the success of the interorganizational network. It was a data-driven network. It was an evidence-driven network. Evidence is at the center of the discussions that they have that supports their learning from each other, that facilitates a process of engagement, of reflective practice, of evaluative thinking that is core to the culture of cooperation that is around learning, innovation, and adaptation. And that monitoring and evaluation not only is an accountability function, but is a support function. By tracking what's happening in the network, what's happening with members, what's happening in society, and those interrelationships, evaluation becomes part of the intervention and part of the transformational change process. That means it's monitoring interconnectedness momentum, identifying, understanding, and evaluating the interconnections that are essential and integral to transformation in order to support, nurture, catalyze, and accelerate transformational trajectories. Which brings us back eloquently to the challenge of major systems transformation toward greater sustainability and equity in the world. Tracking trajectories toward major systems transformation, a major commitment that I discuss in the book Blue Marble Evaluation, about the role of evaluation in supporting transformations. Being able to zoom out for the big picture globally and zoom in to what's happening within local networks and the ways in which networks can be connected together globally, not only networks of non-governmental organizations and networks of interorganizational networks, but indeed networks of evaluator. So we began, and the book begins with the question, can society be saved? The doomsday clock is running, but interorganizational networks, systematically coordinated, provide a mechanism and a pathway for pushing back the doomsday clock. So that's a quick overview of saving societies from within, innovation and equity through interorganizational change. I strongly recommend the book to all those interested in transformational change and evaluating transformational change.